welcome to the clinic. Have you got a cranial nerve exam today? Perfect. Let's get down a few of your details to get you signed in, and we'll get started. Can I have your full name, please? And how do you spell that surname? Okay. And can I have your date of birth? Okay. And can I get your address as well, please? And have you had a cranial nerve exam before, or is this your first one? No? Alright. And do you have any allergies? No? Alright. And do you have any issues with your hearing, seeing, taste, touch, or anything to do with your sensory, taste maybe even? No? Alright. So I've got you booked in. So the doctor should be able to see you now. So if you just head over to room number 2, somebody will be with you in a sec. Alright, so for your cranial nerve exam, we're going to be testing your taste, your sense of smell, your eyesight, your hearing, and your touch. Your 5 senses. 5 senses, 5 senses, 5 senses, 5 senses, 5 senses. Okay, so the first thing that we're going to be testing is your eyesight. So what I'll do first is I'm going to have you look at these colours and name them for me. So I'm going to pull a random colour out, and then I'm going to ask you to tell me what colour it is. So okay, so you just pay attention, and then I'm going to ask you now, what colour is this? What colour is this? What colour is this? What colour is this? Yep, green. Well done. And what colour is this? This is orange. Amazing. And what colour is this? Pink. Well done. Alright. And what colour is this? Yellow. Yep. And final one. What colour is that? That one right there. Blue. Amazing. So I don't think you've got an issue with your ability to judge colour. So that's good. That is good. Next thing I'm going to ask you to do is, I've got this Sharpie over here. I'm going to ask you to follow this. Follow the end over here. So, and you need to cover one eye, and I'm going to ask you to follow this. Are you ready? Good. So I'm going to start by covering your left eye. Now, follow this. Yep, great. Fab. And then I'm going to do the same with your right eye. So I'm going to cover it and ask you to follow. Good. Fab. Now, I'm going to ask you to tell me when it comes into your peripheral vision. Okay, so I'm going to do the same thing, and you just let me know when it comes into your vision. Alright? Right, we're going to do the left eye now, so let me know. Okay, perfect. Now, alright. Yep. Okay, great. I'm going to do the same with your other eye. So I'm going to cover it here, so just let me know when it comes into your field of vision. Great. Fab, okay. Now, right. Okay, perfect. Amazing. You're doing so well. So that should be it for your sense of sight. And you don't wear any glasses, do you? No? Alright. Fab. now we're going to move on to your sense of smell. I've got here some scented water, and what I'd like you to do is tell me what it smells like. Okay, so I'm going to use one of my little sample sheets of paper. I'm going to spray it on, and you tell me what you're smelling, okay? Okay, have a whiff. Okay, what does that smell like? Lemon? Perfect. So these are actually water activated, so these are actually smell pads, I guess. We're going to do the same thing with this one. So the water activates this and it releases a smell. So I am giving you a hint, but the colour is linked to the smell. So what does this smell like? Give it a smell. Cherries. Amazing. Well done. So don't think you've got any issues with your sense of smell. So that's good. That's really good. Now, what we're going to do is we're going to do a sharp and dull test. Alright? So I've got two things with me here. I've got my pencil, which is sharp, and I've got my Sharpie, which has a dull end over here. What I'm going to ask you to do is close your eyes, close your eyes, close your eyes, close your eyes, right? Close your eyes, close them, alright. Fab. So, just let me know when you feel a sharp or dull touch. Okay? Alright, close your eyes, keep them closed. Alright. Alright, yep. Dull, dull, sharp, keep them closed. Sharp, dull, dull. Do you feel anything? Yep, sharp, sharp, dull. Alright, fabulous. I'm just going to write down my recordings of your senses so far. So, sight, good. Smell, good. Sensory, good. The only things we've got to do next are your hearing and your taste. So, let's do your hearing first, because I'm going to give you something sweet for you to have when you leave, and that will be your tasting. Alright, so what I'm going to do for the hearing bit is I'm going to whisper to you words, and I want you to repeat them back to me, and then I want you to tell me if you can hear it and what ear it's coming from. So I'm going to get you to close your eyes again. Close your eyes, close your eyes, close your eyes, close your eyes. Okay, fab. Now I'm going to whisper in one of your ears, and I want you to repeat the word back to me. Alright? Close your eyes. Apple, yeah. 12, yes. And what ear is that coming from? Right, yep. Vanilla. Yep. 3. Perfect, perfect. So, your sense of hearing seems to be fine because I'm whispering and you can hear me perfectly fine. Okay, for our final test, I'm going to get you to taste something. And I want you to tell me what that tastes like. Coming back to our touch